living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Depression can happen to anyone at any age, and it is one of the most common mental illnesses in America, especially for those who are 60 years of age and older. If left untreated, depression can erode quality of life, decrease one's overall health, and in the most severe cases, it can lead to suicide. Don't shrug it off. There's help available, regardless of where you live and your income. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Joining us today is Dr. Roman Hendrickson, a board-certified family medicine and geriatric physician. He is also a fellow of the American Academy of Family Physicians. And recently, he received the Montana Medical Association's most distinguished award for his commitment to the profession and for advocating for ongoing improvements. Welcome back to our show, Dr. Hendrickson.
Thank you.
Can you tell us what depression is and what its symptoms are?
Well, depression is sort of a constellation of symptoms. It's not any one thing. Most people think it's just when you get the boo-hoos, but really it has to reflect when people are becoming incapacitated in their daily life. It can include feelings of sadness, hopelessness, worthlessness, that can last weeks or months. Sometimes it's just people who are just not doing well. They're fatigued, they have insomnia, they're irritable, they can't focus, they have a loss of interest in activities, they start tasks and don't finish them, things start to pile up. It's just a reflection of the fact that their brain is not working at 100% anymore.
So it seems common in our culture to dismiss depression, and people misunderstand it as just being sad, and folks will tell you, just snap out of it. Can you talk about how serious it really is, and that it's more than just feeling sad?
Well, sadness is a normal emotion. It sort of provokes us to act. Unfortunately, if things get out of control, then they're out of our ability to control them. And that means you can't just wish upon yourself that you'll go back to the way you were. It's not usually a temporary, but becomes a chronic problem unless you intervene. It changes the way you look at the world. You might look at a person and say, why are you depressed? There's nothing wrong. Why are you feeling this way? But really, depression for a lot of people is the sum total of a lot of stresses that occurred, and then finally something comes along and just pushes them over the edge. Their perception of the world around them changes. They start to feel worthless. They can't understand why people feel the way they are. They feel unloved, unimportant. It takes away their ability to experience joy. They don't feel connected with their outer world. Sometimes they just cannot become happy anymore.
Why is it important to treat depression, particularly among older folks?
Well, obviously, as depression gets worse, it can lead in the ultimate to suicide. However, the presence of depression can interfere with our ability to treat other medical problems. It's well shown that if a diabetic is depressed, their diabetes is under worse control. Diabetes also affects other medical problems, and we need to control their diabetes to be able to treat someone medically. It interferes with people's ability to function in their normal work environment and in their normal social environment.
Why is it important for people to talk to their physicians about depression or the fact that they have a family history of it?
Well, obviously, people who have a family history of it may be more susceptible to developing depressive symptoms. You're not necessarily doomed to become depressed if you have a family history of it, but it's something to consider. The physician should be an entree into potential treatment for someone and diagnosis. The primary care doctor may be able to initiate treatment, And if you have a primary care physician, it should be someone that you trust and you can start discussing your concerns with.
So what about medication and drugs? So if someone is on a drug for depression, how long does it take for that medicine to take effect?
Medications, depending on the individual person and which medication you're using, some may start to have a positive benefit as soon as 1 week, but usually improvements start to show within 4 to 6 weeks.
So sometimes people with depression are taking their medicine and their drugs, they feel better and they stop taking the medicine. What happens?
The likelihood of sliding back into depression is greater if you haven't been treated for at least 6 months once you've reached remission. So in other words, you can't treat for just to the point where you're feeling better. You have to be treated to the point where you're basically not having any symptoms, that's remission, for at least 6 months before there's a consideration of tapering or discontinuing the medication.
What happens if there are side effects with the drugs?
Well, if there's side effects, then a consideration of either adjusting the dose or changing the medication. And sometimes people's perception of side effects does not necessarily go along with the reality of what's going on with the medication. It may be something else that's going on, but it should be discussed with their treating physician.
So I understand that some drugs actually cause depression, and so talk to us about those drugs.
The one that's of most concern is corticosteroids, so that's prednisone is the most commonly used one. And the higher the dose of prednisone and the longer someone's on it, the greater the likelihood that they'll become depressed. So that's a drug-induced depression, or if someone's already depressed, the cortisone may make it worse. Other drugs, such as benzodiazepines, which are like Valium, Ativan, Xanax, that we use for treating anxiety, we're not sure if it actually causes depression or it just makes it worse. Other drugs, such as muscle relaxers, beta blockers, which are drugs we use for treating hypertension, statins, and other cholesterol-lowering drugs may also increase depression.
So lots of drugs can affect depression. So stay tuned to learn how depression is diagnosed and treated. We'll be right back after this break.